So my interest in healthcare and innovation came at quite a young age. My older brother, Stephen, or Stevie as he was known to many, was born with severe cerebral palsy. He was actually born in Bishop Auckland General Hospital, but was transferred to the special care unit at Newcastle General Hospital, which is about approximately 45 miles away from home. And he spent between 5 and 6 months of the first months of his life in Newcastle General Hospital. So as a result of that, my mum had to give up work to sort of be with him. And then thereafter, he was transferred to Bishop Auckland General Hospital. He pretty much defied medical sort of science because my parents were told he wouldn't live till he was 1 or 2, but he actually survived until he was 20. In the late 1980s or early 1990s, my parents were asked to trial 2 pieces of equipment. One was a portable nebulizer inhaler and the other was a portable suction machine. They were very simple innovations and they were quite small, but it meant that the 2 pieces of equipment could be put underneath his wheelchair. And he could actually leave the house for the first time. So this was sort of really critical, that you could, as a family, experience walks by the river, the park, and for the first time ever it enabled us to be a family of 4 rather than kind of, my mum and me just experiencing those things on my own. So that was kind of life-changing. So the innovations didn't just really help him, they changed family life forever. Those fundamental 2 pieces of equipment were sort of critical to our life, so my mum kept them with his treasured possessions when he passed away. So this was the portable nebulizer inhaler. So there's many a photograph of my parents and I all standing at various times of the day pumping away on this, but as you'll see, it's just a simple foot pump that's attached to the nebulizer mask, and it allows the ventolin or salbutamol medicine to actually be aspirated through the mask directly to the patient. And then this here was the handheld suction machine. And I'm not quite sure how they did this with one hand, but you pump here, it creates a vacuum, and then this tube itself would actually go into my brother's mouth to sort of clear his airways. My personal experience has shaped my experience in life because I knew that I wanted to pursue a career in science. Following my PhD, that was my sort of plan to go into research, but I actually stumbled, if I'm being brutally honest, across a job advert for a technology transfer project manager at RTC North, and actually that was for the AHSN Innovations North project. So working with the front line and helping the front line develop ideas from a concept right through to the development, protecting intellectual property, right through to an actual product. And ultimately you saw the patient benefit, which to me was so rewarding. So I feel very, very passionate about my current role at the AHSN and the AHSN in its entirety, because every day we're being exposed to new ideas, to unmet needs where we can actually make a difference. So we've had some fantastic ideas come through the Bright Ideas Awards over the last 16 years. From very, very high-tech and complicated ideas where we may have even struggled with the title, through to very, very simple ideas that have ultimately all gone on to help and benefit patients. There are so many altruistic people working in healthcare across the region, and I'm really privileged that we get to work with them on a day-by-day basis and the impact that they can make directly to patient care, and I feel a real sense of pride in working with those people.